Hey, I'm Dr. Larsen. Welcome to the video. I'm here with Paula. I've been a patient for a while. She's seen some interesting things so far, have you not?
Yes.
Some fun stuff?
Mm-hmm.
So we're trying to figure out why she has a chronic left neck, and there's a spot around her lower back right next to her spine on the left side that's also weak. So when I hear things like it's always on the left side, or you're describing things on the left side or the right side or whatever it might be, it makes you think a little bit more of what might be causing some neurological disruption there. So first thing we checked was what? The ring, her wedding ring on the left side. She's fine with that. She can stay married. Next thing we checked was one of these smart watches. I won't say which brand this is. That was fine. I checked an earring on the left, even though she wears them both sides, because there's been some videos of people who have one-sided earrings causing one-sided problems. Wasn't it either. So it's back to the drawing board, trying to figure out what the heck's going on. Why is her body not neurologically working? And I'll show you what that looks like in a second. So what we discovered was, I just happened to ask, childbirth, right? Episiotomies, tearing, those types of things. She did not have a C-section, just a normal birth, but most women now tear, or there's a controlled tear, which is an episiotomy. And she had that, and I had told her to fix it quite a while back, months ago probably, and I thought she did, but she didn't. That turns out to be the actual problem. So I'll show you that right now in a second. I exposed you.
That's okay.
Alright, so when we check the lower back, so this is the lower back on the right, pull hard that way. So I'm pulling across this way, and she can hold tight that way, okay? One leg, so here's a glute muscle, push out there, and she's nice and solid on the right side. So one leg here, push, 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 push. She can't do it on the left side very well, so neurologically she's not working as well as she should. So both legs, so a lower back muscle test on this side, pull, 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 hard, 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 and she can't do that either. So left-sided, again, she can't do that. Another one, go ahead and sit up for me, just right there, good, arms out. So I'm gonna check her rotators. So she's gonna pull across, and she can't pull across that way very well because she'd be using a lot of these left-sided rotators. Whereas if she pulls this way, hold across, it's much, much more solid. She has grip there. Go ahead and lean it back. And the last one, because she has neck pain on the back of her, is the back side, right? Mm-hmm. On the left. So neck pain on the back side here. Make sure it's in the camera. So if she comes up and she turns her head to the left, we're testing the right side of the neck. Okay, so push up. And she's really solid there. I can push on that. But if she turns her head to the right, which we're testing her left neck flexors, push up here, she can't do that. Or if we do this, bring her head this way, I'm going to test the right lateral flexor, so hold across. And she's solid as a rock there. If we go to the left side, and she's pulling this way, she can't hold that at all. So we know, get the camera here. We figured out that it's the actual episiotomy site. So she's going to touch with her fingertips on that area. Okay, we're just contacting nerve tissue basically, because per square inch of skin you have about 20,000 nerve receptors. So we're just going to fire those nerve receptors and see if it makes a change in the muscle response. So go ahead and do that. Kind of an awkward position, right? But she's a sport. So hold across this way. So she's going to pull again this direction to the left, so pull across. And immediately she gains the strength. I know it seems like kind of strange, but your body works as one neurological unit. So she's pulling across, and she's much, much stronger there. If we bring her up, turn to the right, again, checking neck side, left side, neck flexors, push up, and she's a lot stronger there. Lower back, so she's going to pull actually the glute down here, so push out, much, much, much stronger, and then the left lower back, so hold across. And that's much stronger too. And obviously that rotator one would be strong as well. But it's just another case where we have to look at everything. Neurologically, the brain's very powerful, but you have to look at what might be disrupting it. Then you have to make sure the patient actually follows through and does it. Right, so she's going to do it this time, but of course she has to mud pack the area. That's what I use currently as of the time of this video. A certain kind of mud pack on different scars, whether it's a collarbone, you know, an old fracture, some kind of a tattoo. Episiotomy site, a little bit more invasive, you know, you don't want to do it, but I'm sure she'll do it now and recover this neck issue and this low back issue. We'll see you on another video.